Good evening and welcome to an interesting and open discussion on depression in the Black community. My name is Gail Graves, and I'm the co-chair of the African American Community Partnership Group of Lake County, otherwise known as the AAPCG of Lake County. We are a community needs-driven effort that's dedicated to helping African Americans in Lake County overcome disparities within our community. We have several key initiatives: health, education and awareness, self-care services and resources, social justice, employee protection, and personal protection equipment. As you can tell, some of this is related to the devastating impact that COVID-19 has had on communities of color. So we ask that you come and join us and collaborate with us as we work for restoration in our community. This evening, we have with us our guest speaker, Dr. Inger Burnett-Ziegler. She's a licensed clinical psychologist and associate professor in the Department of Psychiatry and Behavioral Sciences at Feinberg School of Medicine at Northwestern University. Dr. Inger Burnett-Ziegler has over 15 years of experience providing psychological services, working on anxiety disorders, stress management, and interpersonal relationships. She's worked across industries and nonprofits, but she has a passion for eliminating mental illness stigma and ensuring that all individuals have access to high quality, evidence-based mental health care. So welcome this evening.
Thank you so much for having me, Gail.
Oh, we're very excited. So we're going to get started with our discussion for this evening. And we really want to focus in on depression and the stigmas around mental health in the Black community. So I'm going to start out with a very basic question of what is depression?
Yeah, so, depression has a lot of components. It has the emotional component, it has the thought component, and the behavioral component. So when we think about the emotional component, it's that feeling of being sad, feeling kind of down in the dumps, feeling blue. It can come with thoughts of hopelessness or worthlessness. It can include difficulty concentrating or paying attention. And it also can include behavioral changes like both an increase or a decrease in appetite or an increase or decrease in sleep. In its most severe form, depression might also include thoughts of death or even making plans to harm yourself.
So we are actually, you kind of touched a little bit on thoughts of death, and we are starting to hear more about suicide in the African American community. Can you touch on that for a second?
Yeah, so there's been some recent articles in the last, I would say, 2 years that have really highlighted the quite drastic increases in suicide, specifically among Black youth. There was an article that came out at the end of last year that showed an increase in not only deaths to suicide, but also increases in suicide attempts among Black young men. And that data has recently been replicated in Chicago as well. There was a report that came out in the last 2 weeks that showed similar trends. And I think those pieces of research are really important because we've probably all heard the narrative that Black people don't kill themselves. And that's something that a lot of people don't really think about when in terms of thinking about the mental health in the Black community, but it is something that is important that we pay attention to and know is possible, because otherwise we could miss these people who are at the greatest risk of not only feeling the most severely depressed, but also at risk of harm.
And you touch upon something, when you were describing depression, and one of my questions was, sort of, what is that difference? How do I know when I've crossed from being really sad? A lot of times we say things like not too stressed, we're blessed. How do I know when it's really a greater issue?
Yeah, so as you said, sadness is something that we all experience at different points of time in our lives. And to be honest, depression is also something that I would say a lot of people experience. We know that about 20% of the population will have a diagnosable psychiatric condition at some point in their lifetime, with the most common being depression and anxiety.
Mm-hmm.
But when we're thinking about the difference between kind of the depression or sadness that people experience based on situations or things they might be going through at their life versus a clinical depression, the two things we think about is kind of how long it's lasting, right? So most days, most of the time, having these feelings that of sadness, down in the dumps, blue, crying spells that are really kind of overcoming your experience. And then how much those feelings interfere with your ability to function on a day-to-day, right? So most days, most of the time, and it's so bad that you can't get up and go to work. You can't maybe even get out of bed and shower. You're not eating, you're not taking care of your kids, you're not leaving the house. Those are the signs that the symptoms are so severe that they would meet that clinical criteria and certainly warrant getting additional help.
So I think one of the questions that many people kind of struggle with is, what is the treatment for depression? You know, why are some people on medication, some aren't? Can you talk a little bit about that?
Yeah, so as you've already pointed out, medication is one type of treatment. Psychotherapy is another type of treatment. And within psychotherapy, there are a number of different types of psychotherapy that could be useful for people with depression, depending on kind of how they're presenting and the specific issues that they might be facing. And further, you know, then there are folks that are using both. Right. And so you started the conversation talking about stigma, and just from my own experience and from the research, we know that, you know, in the Black community, there's more stigma attached to medication, right? So there's mental health stigma broadly. But then once you kind of folks get over the hump of saying, okay, I'm ready to think about getting some help, I often hear folks say, well, I'll try therapy, but definitely no to medication. And I think a lot of that is in part to what we think about in terms of the side effects or the risk associated with medication. So sometimes people are concerned about being addicted to medication. They might be concerned about weight gain or loss of their sex drive as it pertains to medication. And furthermore, they might be concerned about, you know, medication meaning I'm really crazy, right? If I just, I'm sorry, you probably can hear this siren my live, so I'm sorry, bear with me. But, you know, I think that contributes to the even greater level. But medications do have demonstrated effectiveness. Sometimes it can be frustrating for people because it can be a trial and error type of thing in terms of figuring out what medication works best for that individual and also tapering them up to the right dose. And that does take some back and forth with your provider and some patients. Similarly, with psychotherapy, it's the same type of thing, you know, finding the right fit with a therapist that you feel comfortable with, being vulnerable with, a therapist that has the tools to provide the best evidence-based approach. Some depression therapies are around kind of getting you to do things that are more likely to bring you joy. Some depression therapies are around changing the way you're thinking about things. Some depression therapies are around changing how you interact with the different people in your life. So there's lots of options out there. And it's just about kind of finding the right fit for what the person is bringing to the table at that particular time.
So one of the things that we're really committed to doing with our education and awareness is really breaking down barriers. And so you use some words. And so I'm going to say, what's the difference between counseling, therapy, and then psychotherapy?
Yeah, so I use therapy and psychotherapy interchangeably.
Okay.
And so for me, I'm a clinical psychologist. I have a PhD in clinical psychology, and my training is around evidence-based psychotherapy, which I use, like I said, psychotherapy and therapy interchangeably. The evidence-based piece is it's a little bit of jargon, but it's an important piece of jargon, because that means that when I'm talking with people, I'm using strategies that have a research basis to demonstrate that these are tools that have been shown to be effective. The lines with counseling can be a little bit blurry, if you will. Sometimes when people say counseling, it's therapy, right? And sometimes when people say counseling, they're not necessarily working with mental health symptoms per se, but more so offering advice, right? So when I'm working with folks, I'm working with people that are coming with certain symptoms. They're coming with anxiety, they're coming with depression, they're coming with stress. And so I'm offering them approaches that target those symptoms. Counseling often is with what we call kind of the worried well, right? So people that by and large they're getting by pretty good and need some support, need some advice. Counseling psychology is a specific field unto itself. But there is overlap and crossover between those two approaches.
So when we think again about stigma, how do we move past sort of that philosophy that we have in the Black community? What happens at home stays at home. Or I don't want to talk about my feelings with people I don't know.
Yeah, that's such an important question, Gail. I'm so glad you asked that. And that's something that I think about a lot in the work that I do. And the thing that always strikes me is that when somebody finally makes it to my office and they've somehow crossed the threshold of these concerns that you're talking about, bringing inside problems to the outside to a stranger, no less. I have the privilege of knowing that there's hundreds of people just like you that think that, you're the only person experiencing this, that this is something that shouldn't be talked about. And I think if more of us thought about it in that way, that these problems that we hold secret, these problems that often we're ashamed of, that we think we shouldn't talk about, so many people are going through them, right? It is actually not like a unique situation. It's just that we're not talking about it. And if we share that, we kind of lift the shame and lift the burden and are able to engage in this collective healing of having a shared experience. I keep bringing the research into it, and there is a body of research that talks about how unhealthy secrets are, right?
Yes.
Not only just as a distraction, but on our bodies, the energy it takes to protect a secret and to keep it inside, and how liberating and freeing it can be to just release yourself of whatever that secret is that you're holding. And of course, that's a piece of what therapy is. And, we have to feel safe in it. And that's a part of identifying a provider that you relate to, you trust, you think offers an expertise so that you can start to engage in that process of vulnerability.
I thought you brought up something really important. Often in the Black community, we have generational secrets. We have secrets that started back with our grandparents and just continue on throughout families. And as you said, sometimes it's damaging to relationships and to people. You touched on a couple of different things. I did want to take a second to talk about the difference between depression and anxiety.
Yeah, so depression, we could say the core feature is sadness, feeling blue, feeling down. That would be the core piece of depression. Anxiety, on the other hand, the core piece is fear and worry, right? So being consumed by excessive worry about a lot of things, right? Anxiety often starts off as stress, right? So you have this environmental, whatever, COVID, work, an argument with your partner, and that causes some sort of stress. And when that's not appropriately managed, it can balloon into anxiety. And when people have what we call general anxiety, they're worrying about a lot of things all the time, right? So it's not just the one thing, it's just kind of this global anxiety that takes over. To get kind of specifics, as we're talking about like what's regular worry and what's clinical worry, to meet criteria for a diagnosis of anxiety, you would have to have this global worry for 6 months, right?
Oh, okay.
And we talked before about depression with it has to interfere with how you get by day to day. Same with anxiety. So that's the predominant feature is fear and worry for anxiety.
Well, you brought up something that's creating a lot of fear and worry and even sadness for all of us, and that's COVID-19. So, how are you seeing COVID-19 really impact our mental health? And again, particularly in the African American community. Here in Lake County, the data shows that for every one Caucasian person that has COVID-19, 4 African Americans and 9 Latinos have it. And so there's quite a fear, especially amongst our elders. So we'll talk about the elders in a minute. So the first is really, how have you seen COVID-19 really impacting our community?
Yeah, I mean, as you already mentioned, we know that COVID is disproportionately impacting the African American community. There are more Black folks that are essential workers that are still having to go to work, that don't have the privilege of being able to work from home. Either they're service providers or healthcare providers or transportation workers or what have you. And that comes with it a fear. We just talked about fear of not only exposing themselves, but also exposing their family members, right, to the potential virus. In addition to that, we see stress related not only to health, but stress related to finances, stress related to employment security, stress related to housing. We know that in the climate of COVID, there has been an increase in calls to the domestic violence hotline. I know anecdotally from some of the other community work that I do that there's been an increase in relapses and folks that may be dealing with addictions, alcohol or drug addictions. And so while COVID is a public health pandemic, I think about it in the broadest sense of the ways that it's impacting health, not only physical health and mental health. And that's showing up as depression and anxiety. You and I were talking before we got started about, the things that people are losing because of COVID, losing, in the spring it was proms and graduations and people that are in transitional periods starting high school or college. And that can come with it a sense of loss of community. So that's kind of the loss is on the depression side.
Right.
And the anxiety side is, well, what's going to happen, right? Like, when is this going to be over? What is the fall going to look like? What are the consequences for school and work and finances and all these things? What is that going to look like? So it's definitely having a broad and really significant impact on the larger society's mental health.
Absolutely. You touched a second on substance abuse. Is there a link between sort of substance abuse and depression or not getting the treatment? Sort of what are those connections?
Yeah, so to go back to the data, about 40% of people who have depression or anxiety also have a substance use disorder. So if we think about that in terms of alcohol, I always love to share these numbers because people are usually pretty surprised by these numbers, but the NIAAA, National Institute of Alcohol, and 2 more A's, but our governmental guidelines in terms of moderate drinking, right? So that would be 7 drinks per week for a woman and 14 drinks per week for a man. No more than 3 drinks in one setting for a woman, no more than 4 drinks in one sitting for a man. And so usually when I present that data, depending on who the audience is, often people are surprised and find those numbers to be lower than what they would have expected. So I think it's important to share because if you have those as just kind of guidelines in times of stress, we can creep up on even casual drinking without really realizing it. You're spending more time at home. You don't have to go anywhere. You're feeling more keyed up and want to relax at night. So you're having couple extra drinks each night. Before you know it, you're kind of getting into those risky drinking guidelines. And, I think it's important just because that's one area in which people can self-monitor to notice how their behavior is changing in response to increased stress. Similarly with anxiety, anxiety and drinking, or anxiety, particularly in marijuana, can go hand in hand because people are looking for a way to feel less keyed up, right? So it seems like something to do that's quick to help deal with that feeling of the racing thoughts, being on edge. And so with increases in stress and anxiety, you can see those increases as well.
What would you say to people who are casual, either users of marijuana or just casual drinkers? You said as your numbers kind of tick up, what, besides the numbers, what else are they looking for, just to be careful about not moving to that zone where you might need outside help?
Yeah, so I think the biggest thing is just pay attention, because usually people don't realize that they've gone up until it's like way up. So just pay attention. I think a change here and there is not necessarily super harmful, but as you're noticing a consistent trend, being aware of that and being aware of what that's about. Another thing is start paying attention to when you start to think that you need this in order to calm down, right? Because that's a slope that folks can fall in pretty easily, that's kind of the first thing that someone turns to in order to deal with the difficult emotions that are showing up. Yeah. And so when you notice that pattern, saying, okay, I notice this pattern is happening, I'm gonna make an intentional decision to choose something else. Right now, I'm gonna choose a walk. I'm a yogi, so choose yoga, choose stillness, choose cooking, whatever it is that you want to choose just in that moment to replace that behavior with something else that might be healthier.
So you touched on something a little bit ago about sort of like the whole loneliness. So I did want to talk a little bit about our elders with depression, particularly in the Black community, or even certain diagnoses that you might have also lead to depression.
Yeah, so you're thinking in general or in response to COVID?
Both.
Okay. Yeah. So I know that this has come up particularly in response to COVID because our elders may not be as technologically savvy as younger generations. And in the context of COVID, we're really relying on technology to stay connected. And so, one thing I say about that is like, we don't forget our old school methods of connecting with people, calling folks on the phone. I've loved seeing these kind of drive-by visits that people are doing. Loneliness among older adults is an area that has been studied for quite some time, and even outside of the context of COVID, loneliness and social isolation is linked to not only poor mental health outcomes, but poor physical health outcomes as well. And so we know that connectedness is important. And I just think we can continue to think about our kind of foundational ways of the way we connect with people. I can say I don't know, I guess depending on who you ask whether I'm an elder or not, but even regardless of if you put me in the elder bucket or not, I can say personally, I have really enjoyed just connecting with people with walks and going to the park, things that I haven't done since childhood, really. And, I like to think about what opportunities COVID has opened up to just kind of going back to the basics of slowing down, taking care of yourself, spending time with people in ways that we might have been too busy for 6 months ago.
And I think it's increased our own awareness of how we take care or don't take care of ourselves.
Right.
One of the things I wanted to ask you too was, what's the relationship or connection of mental health and physical health?
Yeah. So, we've been talking about depression and anxiety, But within all of this is stress, right? So COVID is a stressor, work, finances, all these things, family health, all these things are related to stress. And we know that stress can lead to everything that we've been talking about. Stress can lead to depression, stress can lead to anxiety, stress can lead to hypertension, stress can lead to substance use, stress can lead to stress eating or obesity and diabetes. And so stress is really the common link to all of these health conditions. And so one of my areas of research is looking at how, if you manage stress, you can manage so many other things, right? Just by paying attention to how your mind and your body responds to these triggers. Because stress actually does affect our physical body. You know, it produces cortisol, and cortisol impacts our weight. It impacts the way that we metabolize food. It impacts our sleep. It impacts our heart rate and all of these things. And so if we keep that under control, that's one way that we are keeping ourselves holistically healthy. You know, I think it's an important question because a lot of times, especially when people are not kind of attuned to thinking about their mood and their emotions, we ignore the way stress shows up in the body. So we don't realize that crook in your neck is stress, or those headaches, or the stomach churning, or the heart racing, that is part of the mental health picture, right? Mm-hmm. So if we pay attention to our body, then we can pay attention to the way that our mind and body is kind of operating as one.
Well, when you talk about those things, so either outside of or in addition to therapy or counseling, what are some of the other things that we can do to help either manage our stress or manage when we're, again, crossing that line from day-to-day sadness to something that's overwhelming?
Yeah, I mean, again, going back to the context of COVID, I think maintaining our structure is really important. The lines between work and home can get really blurry. And so I think keeping that structure in place, keeping your routines, if it's working out, if it's connecting with people, making sure those things that keep you well are still in place. I'm a big proponent of carving out time for stillness, which I know, and, you know, with busy people and, you know, really productive folks, that seems like, how could I possibly do that? But I think that time to kind of slow down, be still, be with yourself is really important as well. And then, you know, all of the basic stuff, paying attention to how you eat, getting your rest at night, and those types of things as well.
Okay. I'm going to take just a little bit of a moment if there's some people that have joined in after we got started. This is Dr. Inger Burnett-Ziegler, and she's joining us from Northwestern Medicine. She is a licensed clinical psychologist, and tonight we're talking about depression in the Black community. And this is being brought to you by the AACPG of Lake County, and I'm Gail Graves, the co-host. Yeah, I am the co-host and co-facilitator of the group. Now, this is kind of a big one. We've had some questions around this and discussion about the role of the church and spirituality in mental health.
Yeah, so, you know, I like to think of the church as the first therapy in the Black community. You know, it's a place where not only have we gone to for spiritual healing, but emotional healing and physical healing as well. And, you know, in our discussion today, we've been talking about the importance of connection and community, the importance of having that routine in your life. There's data that shows the health benefits of prayer, not only in focusing your thought, but also improving kind of psychological health. So there's a lot of data to show that spirituality is helpful for mental health. That said, you know, in some spaces, in some conversations, the church has been positioned as being in conflict with mental health. professional mental health treatment, with the idea that if you have enough faith, then you don't need to go to a psychologist or a psychiatrist, that spirituality alone should resolve these issues. And so a few things with respect to that. We don't think about our physical health in that way. So I offer that mental health is not different, right? And, you know, mental health treatment is simply a resource that I think about using in conjunction with one's spirituality and their faith. I get a lot of people that I work with in therapy that are very strong believers, very strong in their faith. And their faith is a important foundation that we build upon in our therapy work. And I always love when I'm working with people and I'm challenging them on their thoughts, and then they come back with me with a scripture, right? And they're like, oh, that's just like, you know, this scripture that tells me to, you know, not focus on things that are here on earth, right? So they're able to kind of integrate the principles of therapy, specifically cognitive behavioral therapy, within their own kind of spiritual understanding. You know, to add on to that, when we're thinking about what we call culturally competent providers, so if you're going to a provider that may not necessarily understand the role of spirituality in the Black community, or just talking about individuals, if you're working with a specific individual whose spirituality is important to them, that can be a challenge, right? So that's in a space in which people should seek out someone that understands their cultural framework and can use these things as values to help their wellness.
So you talked about sort of connecting with a therapist that people feel comfortable with, or you can open up with. Some people are more comfortable speaking with a woman versus a man. Talking about that cultural competency, perhaps wanting to speak with someone who looks like you or may have similar experiences. How do we go about finding a therapist? How do we seek that out?
Yeah, so, you know, it's tough in terms of match, you know, and I get that all the time. Somebody wants a woman, and she has to be Black, and she has to be Christian, and she has to be this age range. And there's not a lot. That's just the reality of the situation. I think the most recent numbers that I heard were about 4%, if we're talking about psychologists nationwide, are Black. Right. And so you start adding these additional specifiers, the pool is getting smaller and smaller. And so while these things can be important, I just caution people against it being another reason not to get help, because we can talk ourselves into that and say, well, I couldn't find somebody that met these 10 criteria, so that's going to be the reason why I don't get help. That said, you know, some kind of practical ways you can find somebody is through your EAP, your Employee Assistance Program. I know personally a number of friends that have had good success with finding race match providers through their EAP, through your insurance network. And if that is overwhelming, which surely it can be, asking your primary care provider for referrals can also be another tool. And then Psychology Today has a nationwide registry in which you can pick out the different specifiers of the type of provider that you're looking for, look at their summaries, the approach to therapy that they take, what they specialize in, and find a provider in that way.
Well, that's really good and very helpful. Because of what you mentioned was sort of how to get rid of our own barriers and blockages, right? So while we want someone that we can feel a connection with, they don't have to meet all the criteria in order to be effective.
Right. And it can be trial and error no matter what, right? So you can have someone that meets your specifiers that it may not feel right in that moment. Just to add on one more thought to that, I would say, you know, giving it a chance. Sometimes it takes a handful of sessions to really kind of get a good feel of what it would be like to work with that person. And because we can have so many resistances going in, there can really be an urge to
Yeah.
drop it too soon. So if you try someone and you're still kind of not sure early on, give it a couple of times and then, maybe think about finding someone else if it doesn't feel right for you.
So one of the things you talked about in terms of sort of giving it a try, but then either getting a referral through your physician, insurance. Here in Lake County, over 10% of our African American residents are uninsured. So if we're concerned about cost or lack of insurance, are there some options available for us in terms of getting therapy?
It always breaks my heart to answer this question because the reality is there are not a lot of great free or low cost options. Even with insurance, I'll say where I am, there's like a 3 to 6 month waiting list if you're, and you have to be in the network. You have to be in our catchment area. So for low cost options, there are some community mental health providers and community mental health centers that sometimes offers sliding scales.
Mm-hmm.
Even with a sliding scale, it could be like 50, 60, $75 per session, which if you're going weekly adds up pretty quickly. Typically, when services are at very low cost or free, that is often with trainees.
Mm-hmm.
And so, of course, I was once a trainee, and trainees do have supervision with licensed providers, but they're starting out, right? And so there are pros and cons to that. You do have someone to offer you some additional support, but depending on the complexity of issues that you might be bringing forth, they may not be able to offer you all that you need in that moment. So that would be at this community mental health centers that have some sliding scales would be a place to start.
Well, I wanted to give you an opportunity to talk a bit about your own practice and kind of just helping us understand what is it that you do at Northwestern.
Yeah, so as you mentioned, I am a clinical psychologist and associate professor at Northwestern. And in terms of my clinical practice, I do have a small clinical practice where I see majority adult women with mood and anxiety disorders. So depression, anxiety, trauma backgrounds. My practice is what I call a generalist practice. So I do a lot of work, the mind and body work that we talked about. I do incorporate mindfulness meditation and yoga into my practice. I do a lot of work around helping people to kind of understand how their thoughts are contributing to how they feel. And helping people to understand how they can change their behaviors on a daily basis to support not only their physical health and mental health. But my clinical work is a small part of what I do. I'm primarily a researcher, and my research is focused on barriers to access and engagement in mental health services in the African American community. I've done lots of years of work highlighting the many things that place Black folks at greater risk for a lot of health conditions, depression, anxiety, stress, and trauma, all of the barriers that we experience, societal barriers, racism, discrimination, stigma that interfere with our ability to get help, and really working toward how we can change systems to make mental health services more accessible and acceptable in the African American community. So I'm a big believer in mental health for all, normalizing mental health treatment. I salute, we talked about this offline earlier, but I salute when people like Michelle Obama and Taraji Henson, speak out about the importance of mental health, because I think that's really instrumental in terms of normalizing the fact that these are experiences that everybody has, and participation, the option to participate in treatment is one that we should take advantage of. More information about the work that I do can be found on my website at ingerbz.com. And you can also follow me on Twitter at IBZ. like PhD. I love to talk about this stuff. I love to keep people, having conversations about mental health, learning of what it means to be depressed and anxious, all of the things that we talked about today. So yeah, feel free, everyone out there in the live sphere, feel free to reach out.
And I think that, it's really important for us to create these kinds of opportunities when you think about any community, but our community in particular, when we have access to someone like you who we're just having a conversation. And even as you're talking, I'm sitting here thinking, well, okay, all that's making sense. Some of my own probably biases were, called out a little bit today as you were talking. And I'm thinking, we all have, in having these conversations, it gives us the opportunity to check ourselves in terms of how we think, but then also think about, even just the mindfulness, how helpful that could be to us. Oh, we do have a question from the outer sphere that just disappeared here. From Rachel Young, what are some of the hidden signs of depression?
Yeah, so the hidden signs, I think, are, well, I'm not sure if my question asker means hidden, like to the outside world. So it could be those behavioral things that we've talked about that people may not recognize means maybe I'm depressed. So it could mean feeling more irritable. It could mean not sleeping at night. It could mean those changes in sleep and appetite that I talked about. If you mean kind of, often when folks are having thoughts of self-harm, that's also not visible to other people that might be in their immediate social circle. When people are feeling kind of really hopeless or worthless, that also may not be immediately visible. And so even though that person is really experiencing a lot of suffering in that moment, I think it's an interesting question, an important question, because going back to the suicide conversation, when someone succumbs to suicide, one of the things that often is said is, I thought they were fine. I had no idea, right? And so we're not kind of keyed up to pay attention to these subtle changes that people might be going through. And the individuals themselves often don't feel comfortable talking about their pain and suffering.
And are there even some conditions that lend themselves to people also having depression? The one that comes to mind is Parkinson's.
Yeah. So absolutely. Parkinson's, a neurological condition that certainly can be associated with depression. Similarly, Alzheimer's. Similarly, other conditions like cancer, where there's a terminal, it doesn't have to be terminal, but cancer and other chronic health conditions that may be terminal can also increase folks' risk for depression and other mental health conditions.
And I think too, even with COVID, I mean, we did see for a while a tremendous loss of life with COVID, which also the whole grief cycle and depression.
Right. That's right. Yeah, I think one of the key signs, I've said this a couple of times, is that hopelessness. So feeling like things aren't going to get better, feeling like you can't, see an end to not only how you feel emotionally, but for whatever your environmental situation will be. And so that's why we know with suicide in particular, that when people lose their jobs, lose a relationship, lose their housing, that's when the risk increase, because there's this sense of, oh my, how am I ever going to make this right and get out of this situation? So these are definitely vulnerable times for a lot of people.
Well, speaking of that, we have a question from Cheryl Hudson Jackson. Are you seeing an increase in depression in parents as they're juggling more with homeschool, working from home, and not enough time alone?
Yeah, so with that group of folks, I would say I think they go hand in hand. Depression and anxiety go hand in hand, but I think I would say I see more of the anxiety, the worry about how am I going to manage all this, the juggling the tasks, the worry about how the change in schooling is going to impact the children long term, the racing thoughts about trying to get it all done. Increased irritability with not having, as the question asker said, time to yourself, time to debrief. I know parents that are doing homeschool during the day and doing their jobs up late at night. You know, their own risk with coming in and out, their risk associated with their children that might be in daycare or might be with nannies now that the pandemic continues to roll on. So with that group, I would say it's mostly anxiety, that fear and worry about all of the what's going to happen.
Yes, we were joking at the start that my son was up at 2 a.m. anxious about starting high school, and we had our talk, and then he said, okay, and he went back to sleep. And then I'm up at 4 a.m. because now I'm anxious because of all the things that we just talked about. So we have to be mindful and conscious of sort of how we handle these things. And it's often easier. I found myself being very calm and, you know, talking to him, and then I could have allowed myself to be like, ah.
Right.
So it's going to start at 9. That's how I was feeling at 4.
Right. So, and parents often take on the worries of their children for them. So that's something that, you know, can be passed back and forth. The parent can put it on the kid and the kid can put it back on the parent.
Definitely, definitely. Well, we thank you for coming sort of out with us this evening and having this discussion and really putting this information and education right here in our community. Hopefully, like I said, I saw some of my own biases as we were talking. So hopefully others felt a shift in how they think about self-care and mental health and the role that it has in our everyday lives.
It's been my pleasure. Thanks so much for chatting.
Thank you. And anyone who wants to tune in, we'll have ongoing series of providers and doing Facebook Lives, as well as we are working to get out over 20,000 personal protection equipment kits into our underserved communities in Lake County, along with our sister organization, the ACL, that's focusing on the Latino community. We'll be having a total of 70,000 kits out in our underserved communities over the next couple of months. And hopefully we will be able to touch base with you again, Dr. Burnett-Ziegler, and we'll be listening because we'd like some feedback and collaboration from the community in terms of other speakers or resources that you'd like to be brought to you. Thank you so much. Good night.
Good night.
Good night.